Welcome to Pediatricks. There are certain habits in kids which cause concern in parents, whether it's normal, abnormal, whether you need to treat or not. So here I'm trying to talk about a few of the behavioral disorders seen in kids. First one, rumination disorder. Rumination is a normal phenomenon seen in animals like cows, where they have their food and then they regurgitate and then chew and then swallow them back. So similar thing occurs in certain kids between 3 months to 12 months of age. They regurgitate whatever they're taken, they chew, they enjoy that and then again swallow it again. But the problem is it is associated with malnutrition and inadequate weight gain. It is quite different from possetting, where regurgitation of little bit of feeds occur. Gastroesophageal is a reflux disease. That is something which occurs in kids that majority of the feed they take is regurgitated because of small tummy volume and underdeveloped gastroesophageal valve and things like that. But when it is really in huge quantities, it can again affect the weight gain of the child. So that is gastroesophageal reflux disease. Vomiting to avoid force feeding. When the parents are forcing the kids to take feeds again and again, vomiting becomes a defense mechanism to escape from that. So this rumination disorder is quite different from that. But since it's associated with malnutrition and inadequate weight gain, that requires medical attention. The next thing is pica. You're persistently eating non-nutritive, non-edible substances like paper, soap, paste, mud and things like that. It is seen in kids about 2 years. Like until 2 years, mouthing is a normal thing. They tend to keep everything in mouth. So that's a normal thing. But in kids, about 2 years, if that occurs and it occurs persistently, it's probably pica. And sometimes it is associated with iron, zinc and calcium deficiencies. And if you find any of those, treat the cause. Otherwise, you bring the child to the doctor and see whether it's just a behavioral change, and you can actually counsel and change the habit. Next is enuresis, bedwetting. By 2 to 4 years of age, they are ready for toilet training, and by 5 years, most of the kids are dry by day and night. If it stays beyond 6 years, that is, if the child is bedwetting beyond 6 years, then child requires evaluation, especially if it's a secondary incontinence. That is, primary they had already achieved bladder and bowel control, and then later they start bedwetting again. They need to evaluate the child. One of the most commonest complaints is constipation, basically. So not passing stools daily is still fine as long as the stools are soft. So if stools are hard along with decreased frequency, that is, either of the two features I'm going to mention happens in a month, then the child requires evaluation. Less than 2 defecation per week. More than 1 episode of incontinence, that after holding that for a long time, then suddenly the baby involuntarily passes motion. Excessive stool retention. A lot of them, and when they pass, it becomes painful and hard stools being passed. Large fecal matter in the rectum, and history of large diameter stools. If any of these 2 or more of these features are present, which is lasting for a month, it's probably functional constipation and requires treatment. It may be associated with loss of appetite, blood in stools, failure to thrive, abdominal pain, vomiting, sometimes fissures and fistula in the anal region and things like that. So you may need a pediatric surgery opinion to treat these conditions, and you may need to treat this functional constipation over a period of time, and then slowly change the food habits and bowel habits of the child. Next is thumb sucking. Thumb sucking is something which is one of the most commonest behavioral disorders in kids, but it's a normal phenomenon up to 2 to 5 years. So it's very common. Up to 25% kids suck their thumb until 2 years of age, and 15% of them continue that till 5 years of age. It's a self-soothing behavior. So if you try to pull it out, they probably develop that habit. When the kids are too young, they do it as a self-soothing behavior, and you try to pull it again and again, it becomes a habit. It may interfere with the palate and teeth of the child once the permanent teething starts. So before that, we need to intervene. That is around 5 years is what American Academy of Pediatrics recommend, and some group of doctors tell after 2 years you can try to stop it. So until 2 years, you totally ignore it. Never try to pull out. You can give them incentives for not sucking their thumb, like positive reinforcement, and identify the trigger, that is before sleep. If they are sucking their thumb, give them a toy to hug. Tell them, instead of this, you can do this, and if you do this, you'll be given a reward, and something like that. Gentle reminders. Never scold, never ridicule, never criticize, never complain this in front of other relatives and friends. So never do that, but creatively try to stop that habit. And by 5 years, you need to definitely stop it, because otherwise it can interfere with teething, and problems can be caused later. Another one is bruxism. Bruxism is the teeth grinding, and it is connected to worm infestation in our say parental suggestions. Okay, the baby is grinding their teeth at night, so it's probably worm infestation. You need to deworm the child. But actually, bruxism is usually seen in less than 5 years of kids, and it is associated with stress. Emotionally supporting the child before going to sleep and giving them stress busting exercises is what the primary treatment is. And the problem with bruxism is that if it is happening continuously, it can cause pain in the temporomandibular joint here, and can cause problems with dental occlusion and the muscular pain and problems like that. Another problem seen in boys up to 5-6 years is beyond 5-6 years is holding the penis. It is a normal behavior up to 5-6 years. It is a curious thing which is sticking out, and in our setup we tend to ignore that area completely, not talk to them regarding that, don't give them instructions regarding cleaning and things like that. And so it is a very peculiar thing for them which is sticking out, and they tend to hold it until 5 to 6 years. So if it is continued beyond 5-6 years, then you need to intervene. First of all, rule out any irritation, infections and things like that. Give them gentle reminders. Again, never scold, criticize or ridicule the child. Distract the child during the act. Give them something to play and things like that, and slowly distract them from doing it. Another problem seen is temper tantrums. It's very common up to 3 years of age. It's a way of showing frustration and anger. You need to intervene before the child is too much distressed, but never show your anger on the child. Most of the time what happens is this happens in a public place where they try to get things done and you are embarrassed, so you try to pacify the child as quickly as possible. So they try and they repeatedly use it as a tool. So don't show your anger on the child, but try to intervene before the child is expressing too much. Basically, timeout is a good option. It's detaching the child from all the other routine play activities and others, and asking them to stand in a corner facing the wall or something like that. So the child shows an episode, say at 1 year, ask them to stand in a corner for 1 minute. If slightly bigger child, 2-year child, ask them to stay away for 2 minutes. So gradually increase the duration of punishment, but it should not be very harsh. So they know that this is something which I should not be doing, and if this is done, I get a punishment. So this way you can actually slowly bring them out of this habit, and talk to them when they are calm. Like you tell them this is abnormal, you should not be doing this, things like that when they are calm, and not shouting at them when they are shouting at you. So this is a problem. When they're too much distressed, no amount of counseling will work. So this is how you deal with temper tantrums. Next one is breath holding spells. This is slightly more scarier. It's very common up to 3 years of age, and basically they cry, and at one particular point they stop crying, they stop breathing, they sometimes turn blue, sometimes turn pale, whitish. Sometimes it is mixed. So these are the 3 basic types of breath holding spells, and it can be associated with iron deficiency. So if breath holding spells are seen, usually you are checked for iron deficiency, and supplements may be given, but that is not the only cause. You can have it can occur just as a behavioral disorder, but any seizure disorder like a CNS problem, any cardiovascular problem, congenital heart disease should be ruled out when you see these kind of breath holding spells. Again, as mentioned in temper tantrums, the child should be managed before the baby is too distressed. Again, never respond with anger. Timeout is again a good strategy, and trying to abort the attack early is a very good way to control breath holding spells, but most of them grow out of it by 3 years of age. Separation anxiety. Kids are very much scared whether they will get separated from the parents. It's again very commonly seen around 10 months. By 7 months, they develop stranger anxiety. By 9-10 months, they are too much attached to the parents. And by 10 months, this separation anxiety occurs. And by 18 months, usually they grow out of it. By 3 years, they accept that temporarily the parents will be absent. They may go for work. They may come back in the evening. So that occurs. But if it stays beyond that, you have to get medical attention. And it's normal to have scared to certain things, like scared to darkness, animals, imaginary situations, things like that. And separation anxiety may be seen associated with these things. So these things isolated are quite common. It's probably due to the inputs they get from the audiovisual media they see or they interact. But separation anxiety, if it stays beyond a certain age, then it needs to be treated. So I think this would help you to identify certain behavioral changes in your kids and manage accordingly. Happy parenting.